Lamorinda Pediatrics has been a pediatric practice in the community now for over 40 years, and I've been a part of it for the last 20 or so years, and really enjoyed being a part of the community, and had the pleasure now, as Dr. Sheaf is retired, seeing kind of multi-generational families come and just that kind of connection. So it certainly has kind of been what I'd hoped as a pediatrician, to really be a part of the community and to watch our children grow into young adults, and it's just a real pleasure and an honor. It was a very dramatic calling out to the community as a whole and nationally, to the realization that we were likely to undergo a true epidemic, that this epidemic posed a threat of substantial morbidity and mortality, that many people would be infected, many people would be affected, and the possibility of significant mortality of people dying in larger numbers than ever really seen with influenza was also a very real possibility. I think the good news is that actually with the interventions and with a little luck, we had the advantage of having it spread out. So at least at this point, if you look at the incidence of H1N1, it was really 2 episodes, sort of April, May, a little bit of June, and again in September and October where we had outbreaks of H1N1. We were able to kind of manage. I think the biggest challenge was getting the vaccine out to people in an efficient manner, and try and have our staff able to do that and have the community be able to receive it. And that worked out well, but not as well as we would have liked. There was problems with the infant vaccine without thimerosal not being stable enough, and so there's some hiccups in the system. But I think all in all that the community responded well. I think we got a large number of children vaccinated. A good number of folks became ill, and as the appearance of the organism was really, again, rampant in the community, people realized indeed that this is not pleasant. Let's get vaccinated if we can. I think fundamentally, immunizations and sewer systems are the 2 things the human population has done to increase our lifespan over the last 100 years. And so I think vaccines, people who are concerned about vaccines, well, they should have concern with any healthcare issue for their child. I think it needs to be balanced with the realization that it's really one of the 2 most potent tools we have to increase the well-being of our children. As I mentioned, I am going to Zimbabwe next week, and I go once or twice a year to Africa, specifically most of the time to Zimbabwe, and unfortunately there are children there dying on a regular basis to measles or other vaccine preventable diseases. And as a pediatrician, having to actually try and resuscitate and have children die in my hands as we're resuscitating for diseases we simply don't see here, brings home very poignantly and painfully the reality of so many children on this planet who don't have access to these vaccines, and what the vaccines really translate to. And should we stop using several of these vaccines, we would soon see resurgence of these illnesses and see our own children dying from measles, pneumonia, and other life-threatening diseases. And I think helping differentiate different vaccines is also important. Comparing vaccines like measles or Haemophilus influenza type B that are saving literally hundreds, if not thousands, of lives of our children every year, and lumping those in with other vaccines such as chickenpox, which is a great vaccine. I'm not saying it isn't, but I do think it's important to differentiate for families that Haemophilus influenza type B is a germ that was causing meningitis, causing life-threatening pneumonias regularly as recently as 20 years ago, and it simply doesn't occur anymore. People should understand these differences and understand the critical need to get kids vaccinated against pertussis, Haemophilus influenza type B, pneumococcus. I think these are ones you just need to get. We owe it to our own children and to our community's children. And other vaccines that can be given over time, and again, the health impact of it is a bigger public health issue over many years and decades, and there's not as much urgency. For families that choose to not just embrace the recommended routine, which again I encourage people to do, but I think it's helpful to separate out and say, these vaccines are truly saving children's lives every day. These are vaccines that are great. And when you look at the illnesses and the things that happen from chickenpox, skin infections, etc., it's worth doing. But you need to understand that these ones are just critical.